You're watching Arab Health TV, and now we're in conversation with the CEO of Amitak Healthcare Solutions, Mr. Mohammed Kenanah. Thank you very much for joining us.
You're most welcome. Thank you very much.
It's a pleasure for you to join us. I'd like to start off by talking about leadership in healthcare. How important is that when it comes to driving or being the driving force for the innovation of the company?
Yeah, healthcare. So the leadership in healthcare is a little bit challenging, and it's like the challenge we're facing here in the Middle East, especially if you're talking about Middle East, it's like surrounded with a lot of factors. So you might face a challenge in starting by the people, because the people usually they're doing the change on the ground. So keeping or retaining your people is one of the factors we're facing. Being proactive, looking to the market dynamics, the rapid change in the market dynamics, and the way the customer is thinking is giving like a burden on the leadership, on the way they're thinking and how to take things forward. So having said that, I think we have to be a little bit innovative, think ahead, try to be integrator, think like how to save cost to you and to the customer. At the same time, you need to provide the service and make it in the reachable of each and every patient. And this is like one of the responsibilities of a leader who's leading a company in the private sector or even the public. So how to reach a mutual goal together.
And talking about that mutual goal, we've seen the private-public partnership models being really predominant. Yeah. Can we see more of that in healthcare?
I think this is like one of the challenges and the goals. At the same time, I see it with the private and public as well. So looking to the concerns in budgets for the private and the reach and the challenges they're facing in public, they need a support, I think. This is what I feel. They need a kind of support from private because it's more dynamic, faster in taking decisions. So here we're like both together, they can do it. Again, I believe in a partnership, not moving the job to the private. No, they have to partner just to make it happen. Because the data today, the government they have, it's going to help the private to do the right approach once it comes to a decision taking inside the government. So I think this is one of the models, business models, is going to take the place in the coming future.
And if you can talk to us a little bit about some milestones that EHS has achieved over the years.
We're trying, what I call like a 4D growth plan. So we're growing in regional, we're growing in solutions and portfolio, and I link all of them to a time frame, which I call like the 4D growth plan. We expanded our activities in different countries. In Saudi, we have like a good footprint nowadays with different solutions. So we're trying to mobilize the expertise we have at UAE to the other countries. We started in Saudi, we started doing a really good job. In Oman, we were there as well. We started activity in Syria and some of African countries. This in terms of territory. Product and solutions, we're also enhancing our portfolio. Solutions, I think, and I'm proud to say, we're one of the leaders once it comes to healthcare, IT, and AI technology. We started implementing tele-ICU, telemedicine, a lot of initiatives in this area, and I think this is going to be the future.
Well, we look forward to that, and we wish you all the very best. Thank you very much for joining us.
You're most welcome anytime.